Okay, I think if y'all are ready, we can get started. Good morning, everyone. My name is Teresa Northington, and I'm the Developmental Screening Coordinator for the Bureau of Family Health. And today we're continuing with our second webinar for the Developmental Screening Summer Series. And we have here today from the Bureau of Family Health, the Family Resource Center. Today, our session will be led by Dr. Lenora Robinson and Claudia Loston. So I will give it away to them to get started.
Good morning, everyone. It's a pleasure to be here, and thank you for having us. And we hope we can bring you insight to the Family Resource Center. We're the Family Resource Center, and as you see, this is our postcard that if you have not had an opportunity to see it at this point, you will be seeing it soon because we are extending out to clinics, and we hope to start attending health fairs and other external events that will give the public a broader view of the Family Resource Center and what it is we do in the community. We support families and providers, and we offer a wealth of resources. We even have regional resources. So we have resources that are specific to some regions that we're able to offer to families, and especially families with children with special healthcare needs. And we're going to go through, and as we go through our little overview, we're going to also explain to you where we fit in the screening process and how we go about referring families to resources. Next. Who we are, we're the Family Resource Center. We're a statewide virtual resource center design, and we come under the Bureau of Family Health umbrella. We specialize in families with children with special healthcare needs. However, we have done a great job of expanding resources to families. We also have an FRC side, and we take referrals from outside sources and call-ins. So our primary is assisting families with children with special healthcare needs. And my staff consists of, this is the dream team. I'm the resource manager, of course, Lenora Robinson. My right hand is Claudia Lawson. And we're the only two full-times at this point. However, we're growing in leaps and bounds, and we expect that to change. Our wealth of knowledge comes from Claire Brown, who was a part of the original Family Resource Center, which existed in the Children's Hospital in New Orleans. And like I said, now we're virtual, so we rely on her for a lot of insight as to what they were able to offer, as opposed to and to add to what we're able to offer now. Kaylee Hall is our care coordinator consultant. She does a fantabulous job of keeping things together for us internally, and she is key in developing the care coordination toolkit. And Tiffany Williams is our clinic experience. She actually has 2 days in office with us, a day remote, and 2 days in the clinic. So she brings us a wealth of knowledge from that clinic aspect, and we're able to identify some of the needs that exist in clinics as we begin to want to venture out and broaden our presence in the community. Claudia, I think this is you.
Yes. The Family Resource Center provides family support, and we do that in 3 ways. We connect families, we link families, and we provide resources. We connect families to healthcare providers to support services such as early intervention, childcare assistance, insurance, and disability support. We link families to any and all resources that impact their family health and child health, the overall family and child health. We provide resources to help youth transition to adults. And these resources include employment, independent living, education, insurance, and legal supports. Our service hours are Monday through Friday, 8 to 4, and our contact information is below. We also have a phone line that's open 8 to 4, and that phone line is 504-896-1340, where you can leave a message for a referral. Next slide, please. So the Family Resource Center does an early childhood assessment to families that are interested in having an assessment done on their child. It's totally up to them, but these are some of the questions we ask, and it helps us systematically identify the child's and family needs. We ask, do you have any concern about your child's development? Or does your child have any medical condition that potentially could affect their physical development, mental, social, emotional, or taking care of themselves or communicating? And here are some of the resources that we link them to if they have a yes answer. Yes, I'm concerned with my child's development. We have early steps. We have Exceptional Lives, Louisiana, which is a resource where they have a umbrella of resources within for children and families with special health care needs. We have the CDC developmental milestones. Sometimes parents say, I want to wait maybe till the next well visit to discuss it with the doctor, but I'm not sure on my baby's development. So we share the developmental milestones so parents can track the developmental until they get back to the primary care physician. We also have Room, which is a set of brain building activities from birth to 5 that we share with all parents that have children 0 to 5 to help them develop those brain developments. And we have OCDD, which if a family has a child with special health care needs, we educate them on the services that they provide. And we also have Families Helping Families that we use and collaborate with on a regular basis for that family support and that peer-to-peer support. Next slide, please. So we have disability agencies, and the disability agencies we have are listed, and I mentioned the early steps already. We have Governor's Office of Disabilities Affairs, OCDZ. Also, we have the pediatric daycares that some of the parents, we link them to if their child has a special health care need that's under the disabilities where they can qualify for that. We also help them with SSI if they have a known disability, and we have resources for other states. Some of our parents have moved on to other states, so we also link them to resources in their states as well. Next slide, please. And for behavioral health, we have autism providers. We have the emergency crisis hotline. We have family in needs of services at Children's Hospital. We have all of the human service districts, which is listed in our regional resource guides for every region. And we have mental health services. And we also have which is not listed, the provider to provider consultation line. And it's with the Bureau of Family Health. And that provider to provider consultation line, it services children from 0 to 21 and pregnant and postpartum moms with depression if they have any signs and symptoms and want to talk to a physician Uh, they can call the provider to provider line, and it's they get to talk to a psychiatrist, not in real time, but really quick. Next slide, please. We have family and youth supports, family helping family. We have McV that we work with and collaborate with. We have the waiver support with the human service districts, and we have a lot of, we are the Family Resource Center, and we have all of those resources for family and youth support. Next slide. So this is a case example of a call that one of the resource specialists got in, and it was a New Orleans family, 13-month-old, not walking, and mother was concerned with the lagging development. So the FRC resource specialist did a needs assessment and identified early steps, which early steps in greater New Orleans area has a waiting list. So, but early steps have case managers that have occupational therapy, physical therapy, and transportation to and from appointments if needed. So along with early steps, the resource specialist referred the parent to training grounds. Training grounds is in New Orleans and greater New Orleans area, and they also work with early steps with the initial process, and they work with the parents and the family, the child, until the early step, all through the early step process, and they have a center where the child can go for parent training and consultations until the process is complete with early steps, and they are provided services through early steps. We also had Families Helping Families get involved with information and the training coordinator to help the family with supports and resources. And we also gave the family room, which is not listed, to help the parents work at home on activities with the child for brain development. Next slide, please. So we have our referral process and follow-up. The referral process is upon receiving a referral, a confirmation email of the referral and the name and contact information of the assigned resource specialist is given to the person making the referral. Once the resource specialist receives the case, they will call the family and conduct a needs assessment. They will then identify the resources. Follow-ups are scheduled according to the needs of the family. Once the resources is given to the family, they're given verbally and emailed to the family. Upon completion of the assessment, the provider is emailed the results of the needs assessment, and the resources provided to the family is emailed to the provider as well. Next slide, please. Now I'm going to hand it back over to our Family Resource Manager, Lenora Robinson, to tell you how to make a referral.
Okay. How to make a referral. Let me start off. I have to brag. We have developed updated, modified card. And as you see, our card is in sync with what's going on now. We have a QR code. It is live, and it takes you directly to information that will guide you into making a resource. If you're not computer savvy and not phone savvy, and just say we got a grandmother or grandparents that are in need of making referrals, we made sure it is all generation friendly, because we still have the 504 number, which is 504-896-1340, or you can email us. And one thing about the phone call, if we're not let's say it's after hours or before hours, if the phone call comes in, you leave a message and it will automatically email us to alert us that there is a message waiting, so that referral is not lost in process. Like I said, you can email directly to BFH Family Resource Center at la.gov. Email coming into the FRC is directed to our main database. Everyone has access, whether they're full-time or part-time. So there's always going to be someone to address your referral needs. Next slide.
That's it. That's it.
So that's how easy it is to make a referral through the Family Resource Center. And even these QR codes are live. So if you have your phone and you snap it, it is working. And like I said, we not only focus on those children with special healthcare needs, we focus on families. Because many times if you have one problem or problem with the child, you have other situations going on with that family, even if it's just an anxiety. So we want to make sure we get out, that we get known, that we're here to help.
Perfect. We did have one question there about who can refer to the FRC.
Right now, we've done a training that involved the MCOs across the state. So they're in clinics. So they are definitely referring. We have built alignment with the NBFH. So other partners with the NBFH, they have been referring. And of course, you can self-refer, which is why we have the QR code. If you have a need or know someone with a need, you're welcome to share this. And it comes in on our FRC side. So automatically, like I said, it comes in, one of us will get that referral and begin to address it. So we're not limited. Any other questions?
I'll check in right now. Thank you so much, Lena, for putting in the information for the PPCO.
Yes.
If you would like more information on the provider-to-provider consultation line, Lena has placed in the chat the link to go directly to the PPCL page, if you would like that. Otherwise, if you came in a little bit after my initial welcome, if you could please put in the chat your name and where you're coming to our webinar from, and possibly your profession would be fabulous, so that I'm able to send you the link for the evaluation. Do we have anybody else who has any other questions while they're on the line here about the FRC referral process or actual referral resources? Anything else? Yeah.
And let me just add, like I said, the card got modified and we're able to come into the 21st century with what's going on with cell phones. Our next big move is we're in the process of addressing the needs of non-English speaking population in Louisiana. We're starting, of course, with Spanish and Vietnamese. So we're hoping to make that happen within the next 30 to 45 days. However, when you come into when you use the QR code and you access our page in the LDH manual, that page has the ability to be translated. So if you're working with a family and they're Hispanic, or matter of fact, it's like, I think about 12 to 15 languages in there. If you will go to the BFH page, you can actually go down to the bottom of the page, hit translation in the language preferred, and you're able to print them out a resource sheet that you can share with them. And that within itself is a way of referring if you're not comfortable because there is a language challenge, it can be addressed. And we're trying to get to the point where we can better address because we know that language barrier is a big part of the disparity that others experience in the healthcare process.
And maybe you could mention a little bit about the language line that you have when
We
families
do.
call in as well.
We do presently use the resource, the language line, and we're able to communicate through a third party, the language line itself. We're hoping, if all goes well, that we're actually able to hire someone that is fluent in Spanish to assist us. We've had the pleasure, let me give Dr. Northington a pat on the back. We've had the pleasure of having her assist us. And it's kind of been a Band-Aid situation, but it's been a beautiful situation where at least we're able to communicate some of the resources available through the Family Resource Center in Spanish. And if nothing else, provide them a letter so they are able to understand what's available. So we've been tearing down barriers little bit by little bit, piece by piece, but we're getting there.
Good. I don't see any other questions. And if you have any other questions, please feel free to email the Family Resource Center at the email that's on the screen. And of course, call them. And if you have any questions, want to make a referral, please do that as well. And if there aren't any other questions, that will be the end of our webinar this morning. I thank you all so much for attending, and I would like to thank the FRC representatives today for sharing information with all of us. And I hope everybody has a wonderful day and morning. Thank you all so much.
Thank you.